Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I want to answer another question from one of our readers who says, what needs to happen for my mum as a next step to get off the ventilator? Well, that's a great question. And, before I answer the question, I need to bring it back to what I've been saying for many years now, that the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And this is exactly what's happening with this particular question, because what needs to happen for my mum as a next step to get off the ventilator? Well, it depends. It depends whether A, your mum has a breathing tube in her mouth, or B, she has a tracheostomy, right, and is ventilated via a tracheostomy. So in the first instance, if your mum has a breathing tube in her mouth, she needs to be weaned off sedation. She needs to come out of an induced coma, and then she can be weaned off the ventilator, right? And I have made an article and a video about this, how to wean a critically ill patient off the breathing tube and the ventilator, and I will link towards that video and article so you can have a look there. And the other scenario is if your mum has a tracheostomy and is ventilated by a tracheostomy, well, then she needs to be off sedation. But the good thing with the tracheostomy is she can be more flexible. What I mean by that, it's easier to take a patient off the ventilator via a tracheostomy, put them back on it. It's easier to wean them once they have a tracheostomy. But it's also not a good sign if she does have a tracheostomy, because that also means she has failed weaning off the ventilator and the breathing tube to begin with. Okay, so again, the biggest challenge for families in intensive care is that they don't know what they don't know. It is critically important, that when you reach out to us, that you have as many details as possible, right? And that you do your research from day one, right? Because it's a very vague question. It's great that you're asking it, and I'm here to answer your questions, but it's a very vague question in the context of intensive care. I have worked in intensive care for over 20 years in 3 different countries. I have worked as a nurse unit manager for over 5 years in intensive care. I have been consulting and advocating for families in intensive care all around the world as part of my intensivecarehotline.com for over 10 years. And we're also looking after ventilated adults and children with tracheostomies in the community as part of our intensive care at home. So really, talking about ventilation, whether it's with breathing tubes or with tracheostomies, bread and butter. For me, I've been doing it for decades. So, you've come to the right place here. Now, there's also an article that I will link to, article and video that I will link to below this video, how to wean a patient off the ventilator and tracheostomy. There's also a step-by-step guide. So I will link to that as well. So I hope that answers your questions. And that's my quick tip for today. If you have a loved one in intensive care and you need help, go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. Also, have a look at our membership for families of critically ill patients in intensive care at intensivecarehotline.com. Click on our membership section there, or go directly to intensivecaresupport.org. In our membership for families of critically ill patients, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. I also offer one-on-one consulting and advocacy over the phone, via Zoom, via Skype, via WhatsApp, whichever medium works best for you. And I talk to you and your families directly, and I advise directly. I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking, but you must ask when you have a loved one in intensive care, so that you can make informed decisions, have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams. I would not go into a family meeting if I was you with intensive care teams without having a written agenda, and B, without having an advocate and clinical representation there. Otherwise, they will walk all over you. Now, we also offer medical record reviews in real time for patients in intensive care, for your loved one in intensive care, so that you can have a second opinion in real time. And we answer, so that you can have a second opinion in real time. And so that once again, you can make informed decisions, have peace of mind, control, power, and influence. We also offer medical record reviews after intensive care if you have unanswered questions, if you are simply suspecting medical negligence, or if you simply need closure. Now, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, or what questions and insights you have from this video. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.